to get into my share. Can you see the slides okay?
Yeah.
Okay.
Okay. You're good.
All right, good afternoon. My name is Melody Conkin. I'm the SHIP coordinator with the First Tennessee Area Agency on Aging and Disability, and we're going to do a short presentation today about Medicare fraud and prevention with the SHIP program. We do also work with the Tennessee SMP program, which is the Senior Medicare Patrol. So SMPs are a nationwide program, as well as SHIP being a nationwide program. And SMPs help Medicare beneficiaries prevent, detect, and report healthcare fraud, help preserve the integrity of the Medicare program, and it does rely on volunteers to help perform SMP work. So the SMP mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. SMP is a federally funded program. Its funding comes through the Department of Health and Human Services at the federal level. And we're going to talk today a little bit about the differences between fraud and abuse, a few things to look for, and a few scams that are kind of always going around, and some that are going around right now. So we'll talk first a little bit about what the difference is between Medicare fraud or Medicare abuse. Medicare fraud is defined by HHS, or Health and Human Services, as intentionally billing Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. And Medicare abuse is defined as providers supplying services or products that are not medically necessary or that do not meet professional standards. So some examples of Medicare fraud and abuse would be billing for services, supplies, or equipment that were not actually provided, obtaining or giving a Medicare number for free services. So if something is advertised as free, such as at a health fair, a test at a health fair, or things like that, they should never ask for the Medicare number. That should just be free. If it's actually free, they should not be billing Medicare. That can also be claims for services that are not actually medically necessary, or using another person's Medicare number, or letting someone else use your Medicare number to obtain medical care supplies or equipment. So a few steps to prevent healthcare fraud would be protect, detect, and report. So step one, protecting yourself from Medicare fraud and abuse. What we always tell people is do treat your Medicare card and number like your credit cards. So don't just be giving out the Medicare number. Your Medicare number used to be your Social Security number. That's no longer the case. It's now random letters and numbers, which is a good thing, but you should still protect that number and treat it like you would your credit card number. Always watch out for identity theft, and do be aware that Medicare doesn't call or visit to sell you anything. So if someone calls saying they're from Medicare, or also from Social Security or the IRS, those federal agencies will always send a letter. They will never call you. And don't, in order to protect yourself, don't give out your Medicare number except to your doctor or other Medicare provider, or if you call 1-800-Medicare yourself. And don't carry your Medicare card unless you'll need it. Step two, detecting Medicare fraud and abuse. It's always a good idea to do your Medicare summary notice when those come each quarter, or your explanation of benefits if you're on a Medicare Advantage plan. So check those for services you didn't receive, or for double billing, or for services not ordered by your doctor. You can also access your Medicare information on Medicare.gov, mymedicare.gov. And SMP does provide personal health care journals that you can use to help keep track of appointments and services and things like that. If you think you've been a victim of Medicare fraud or abuse, or you suspect it or concerned, not sure, you can always call SMP. You can see that number 1-866-836-7677. And we'll talk a little bit about protecting from Medicare enrollment fraud and the rules for that. The Medicare open enrollment period did just end, but I did want to go over a few points about this anyway, particularly for anyone who might be new to Medicare, or some things to remember for next year during next year's Medicare Part D and Medicare Advantage open enrollment period next fall. So a few points to remember. Know the rules about how Medicare plans and agents can contact you and market. We'll talk about a few of those. Know how to avoid potential enrollment fraud and how to protect yourself from enrollment fraud, and know how to report suspected fraud and marketing violations. So a few things to watch out for or to avoid is people who might pressure you with time limits. There are, of course, enrollment periods and dates that you do have to use with Medicare. For example, the annual open enrollment period when you can change your Part D or Medicare Advantage plan is October 15th through December 7th each year. But watch out for anyone who really pressures you a lot about the time limits. They should just let you know about them, not pressure you. And watch out also for anyone who asks for your Medicare number, Social Security number, or banking information in particular. Medicare will not ask for that type of information. Anyone who threatens you with the loss of your Medicare benefits if you don't sign up for their plan or their program. Offers of gifts to enroll. Their Medicare agents or plan agents rather are not allowed to offer gifts to get you to enroll. People who say they represent Medicare, sometimes the advertisements and things like that and that you get in the mail, they're not allowed to say that they represent Medicare, but they can look a little bit like maybe they do. So do be careful of those things. And then also anyone who calls uninvited. Advantage plan or Medicare Part D agents are not allowed to cold call you or call you uninvited. So always watch out for any uninvited calls. A couple other things. Remember, again, protect your Medicare and Social Security number. If anybody's calling you, pressuring you, or asking you for that over the phone, my first thought is always that that is a scam. Because again, Medicare, Social Security, IRS is not going to call you to request that information. So the best situation if someone is pressuring you for that or asking you for that is to hang up and then call the toll-free number for the federal agency that they're saying that they're from. So hang up and call 1-800-Medicare or hang up and call your local Social Security office. Again, beware of unsolicited calls from anyone asking for personal information. A good rule of thumb these days is if you don't recognize the number or you're not expecting that call, maybe just let it go to voicemail or to the answer machine and see if they leave a message. Always rely on government websites, letters, or emails for unbiased information. If you need translation services, always request that if you need it. And confirm everything that an agent tells you before making a final decision. So double check what they've told you with your doctor's office if you need to, or by calling 1-800-Medicare, and always get things in writing if you can. Be aware that you always have the right to choose how you receive your Medicare coverage. So you have the right to choose the plan that you want and how you get your coverage. And do your homework before you do sign up for a plan. Your current plan each fall in September will always send you an annual notice of change, telling you what changes they're making for their plan for next year, change in premium or copays, those types of things. So always review that. Think about what matters most to you for your plan for next year. Is it going to fit your budget? Does it cover all your medications? If you're looking at a Medicare Advantage plan, are your providers going to be in the plan network? And all of that type of thing. Check the plan star rating. So see what Medicare has them rated at. Medicare will rate the plans on a 5-star scale. From more stars is better. On that, based on customer satisfaction, complaints about the plan, how they handle appeals, and all of those types of things. And then compare your options if you want to. If you don't like the changes that your plan's making for next year or a little bit concerned about them, shop around and see what else is available. You can always do that by calling the SHIP program or by calling 1-800-Medicare or checking yourself through Medicare.gov, Medicare's official website. A few rules if you decide to go through an agent, which is perfectly fine. But if you do meet with an agent to select your plan, just remember a few of the rules that they have to abide by. During the meeting, Medicare plans and people who work with Medicare can give you their plan materials, tell you how to get more plan information. They can tell you about the plan options that you agreed to discuss beforehand. So they will ask you beforehand, what you would like to discuss and agree on that. And then they're allowed to discuss those things when they meet. They're also allowed to give you an enrollment form and collect your completed form. If you decide to enroll when you meet with them, you do not have to enroll just because you meet with them. And they should also leave business cards, or are allowed to leave business cards for you to give to friends and family if you want to. A few things that they are not allowed to do is charge you a fee to process your enrollment into a plan or steer you into a particular plan. So they are also not allowed to communicate incorrect information about their plan type or use inappropriate statements. Medicare does not allow people who work with plans to say things like their plan is the best or the highest ranked plan, or this is the best plan for you. So they're not allowed to steer you into that particular plan. They can give you the pros and cons of each plan option, what the copays are, and the information about the plan. But they're not allowed to steer you again or tell you this is the best plan for you. They cannot tell you about other plan options that you haven't agreed to discuss unless you specifically ask about them. So to discuss these options, you need to complete a separate appointment form. So for example, if you decided to meet with an agent about Medicare Advantage plans, and that insurance agent also sells life insurance, they're not allowed to bring up to you during the meeting about your Medicare Advantage plan that you've agreed to and try and sell you a life insurance policy too. They're also not allowed to pressure you to join their plan by saying things, you have to join this plan or you won't get coverage next year or anything like that. They can leave cards with you to pass on to family or friends, but they cannot ask you to give names or phone numbers or addresses so that they can then contact your family and friends. And they also cannot ask you to sign the enrollment form before you're ready to join. So they can leave the enrollment form with you, ask you if you'd like to join the plan or not, but you don't have to join the plan just because you have agreed to meet with them. A couple of examples, or a few examples of enrollment fraud is if an agent enrolled a beneficiary into a plan without their permission. The big no-no, of course. An agent who told the beneficiary that their physician takes the plan, you should always double check with an Advantage plan in particular, check with your doctor's office and check directly with the plan to be sure that your doctor is in network. If they offer you free trips or meals in returns for signing up, that's also fraud. They're not allowed to do that. Or if they misrepresent the plan's benefits, tell you that the copay at the doctor or on medication is something that it's not, or that it covers a benefit that it does not cover. They're also not allowed to tell you that you have to sign up or you'll lose your Medicare. A few enrollment scams or what to look out for: bogus Medicare representatives. So people, again, calling saying they're from Medicare, representing Medicare. Not the case. Threatening loss of coverage, fake rebate notices. So if they send you, tell you, yeah, you're getting a rebate on your premium, things like this if you sign up, or counterfeit sales materials or fake emails. So if you suspect or are concerned that you might have run into enrollment fraud or feel like you've run into a plan or an agent that has violated Medicare's marketing rules, save all the documented information that you can, any signed papers, business cards, marketing materials, or phone records, and you can report that to SMP. Our state director is Lonnie Hitchcock at 1-866-836-7677. And I did want to mention a couple or a few other scams that are going around right now. It seems like constantly. And now that the vaccine is out, or coming out, the COVID-19 scams, we expect to see an increase in some of those. I'm also going to mention a brace scam, Social Security and IRS. So some reported scams already with COVID-19. So scammers sending faxes to doctor's office for signatures for COVID test kits or N95 masks. Calling or sending information offering you a free virus test kit in exchange for your Medicare number. Calls. This particular would be a call that a grandchild or a family member needs money. They're stuck in another city because of the virus. I think those have slowed down a little bit since people are allowed to travel a little bit more. Unauthorized test kits sold online. So if you need a COVID-19 test, of course, always consult with your doctor or your county health department. At-home serology tests sold online. So those would be like the antibody test. There are some of those that are approved, but you need to go through your doctor in order to get those. Also calls from phony coronavirus contact tracers. Of course, there are legitimate contact tracers if you've been exposed to someone with the virus, but those would normally come through the health department in your county. So if you run into something you think might be fake on that, always hang up the phone. Selling fake cures on social media or email or text messages. Again, sort of related to the contact tracing that claims you might have been in contact with someone who had COVID, or asking you to follow a link to capture private information, sort of like the phone scammers will do sometimes on messages and say it'll be a robotic voice that says this, this, and this, and press 1 to talk to an agent or talk to someone, and then you're kind of on the hook. The same thing with the text or emails asking you to follow links. So if you get something like that, it's always best you can contact your county health department to see if you've actually been in contact with someone who might have had COVID. Since we're on COVID, I wanted to mention a couple things that Medicare will pay for with COVID and how it works. Of course, Medicare has greatly expanded their telehealth visits during the public health emergency and pandemic. So telehealth visits now with your doctor can be done from your home. And they can be done either by video call through whatever platform you have available or the doctor has available, or by just telephone audio call if you don't have access to a video call, and the doctor can turn that in as a visit. If you're concerned about going into the doctor's office or are not able to, you can do a telehealth visit, and Medicare will pay for that visit as a regular doctor's office visit. COVID-19 testing. Of course, the county health departments in Tennessee, you can go and get a test, of course, for free, but Medicare will also cover the tests at 100%. It will cover the first test or one test, COVID-19 test at 100% without a doctor's order. After that, any further testing will still be covered at 100%, but you'll need a doctor's recommendation for that. And then the COVID-19 vaccines. Of course, these first batches, the government has bought however many 100 million doses of the different vaccines that they expect to become available. So the government on these initial ones plans to pay for the medication. Doctors or providers who administer the vaccinations on these initial ones will be allowed to charge a copay for the administration, but Medicare will pay for that administration copay for you. So there should not be any cost to you. Any additional vaccines later on, if we need to get the vaccine yearly or however often it's recommended, Medicare will cover the cost of those vaccines just like they do any other vaccine. It should be covered just like the flu shot each year as Medicare covers it. So that should be covered at 100% in the future as well. Okay, the brace scam. This scam's been going around for a while and it's still going on. So with this scam, people will get calls from someone who says they're from Medicare and they offer a free or low cost brace, back brace, knee brace, those types of things. And we'll want your Medicare number information. And then sometimes they'll actually send a brace, sometimes they won't, but maybe you don't actually need it usually. Sometimes a box of brace or braces will actually just show up at people's houses that the person is not ordered or the doctor is not prescribed. In that situation, if you get a package that you're not expecting, you can always, if you can, refuse to accept the package. Of course, sometimes they drop the package on your door and leave. You didn't even realize it was there. In that situation, if you get a package that you were not expecting, you don't recognize the address that it came from, you can always call FedEx or UPS or the post office and ask them, this is not mine. I did not order this, and refuse to accept it that way. If you can. And they will sometimes, scammers will sometimes also send faxes to the doctor's office for signature for braces. So the big thing to look out for that is calls from people saying, we're going to send you a back brace or a knee brace and asking for your Medicare number, or if you get a package that you are not expecting, and then they'll try and bill Medicare for it. Social Security scam. This one has been going around a lot. I know a number of people who've gotten calls like this that the caller claims to be an investigator with the Social Security Administration and say your Social Security number has been used fraudulently and you need to contact us immediately. We need to talk to you, or maybe there's even a warrant out for your arrest. It's been used illegally, that kind of thing. Or there's an issue with your Social Security because your Medicare, your Social Security number has been used fraudulently. Those calls are always scams. Social Security will not call you with an issue like that. If again, Social Security, just like Medicare, will always send a letter and will not call. If you get one of those calls, Social Security would like you to report it to their Office of Inspector General with as much information as you can provide. If you have caller ID, jot down the phone number or anything like that that you can, if they leave a name or anything. And you can report that to the Social Security OIG at 1-800-269-0271. And then the last one I wanted to mention was an IRS scam. Of course, those will start up again, especially this spring around tax time, that the caller claims to be with the IRS and says you owe back taxes. Again, the IRS is not going to call if that was the case that you owed back taxes. They'll send you a very official looking letter that'll come from IRS. And the IRS would again like you to report that. You can report that by email. You can see the email address there, phishing@irs.gov, and put in the subject line IRS phone scam. Again, if you don't recognize the number, just don't answer it. See if they leave a message, or if you do answer, don't provide any information. Don't punch 1 or 2 or anything like that. If they want you to, just hang up. And then when you report the fraudulent call, again, please just report as much information as you can is what they ask. The telephone number, if you have caller ID, any numbers you were instructed to call back, and just a brief description of what they said. If you can get any other information, the exact date and time you received the call, any name that they left or anything like that, they'd ask that you include that as well. So if you do run into Medicare fraud, abuse, or billing questions, please call SMP. Again, the statewide number is 1-866-836-7677. If you have any general Medicare questions, need help comparing plans or anything like that, you can always call us as well with SHIP. That's 1-877-801-0077. And with the First Tennessee Area Agency on Aging, we do, of course, Medicare counseling and events like this, but we also do non-medical services in the home, such as help with light duty housework, Meals on Wheels, those types of things. So if you or anyone else would like more information on those services, please call our information and assistance number. That's 423-928-3258. I'll say that one more time, 423-928-3258. And thank you all very much. I think that's all I had.